nací en Tulimán. El día no lo sé, pero la fecha sí. El año fue el 27. Tuve 7 hermanos, 4 mujeres y yo, y 2 hombres, somos 7. Allá me crecí en Tulimán y me vine para acá cuando me casé. De niña tenía yo una vida bien triste y te voy a decir que mi mamá rete sufrió. En mi pueblo ves que hacen muchas cosas de barro y mi mamá con esto nos mantenía. La verdad es que mi papá era muy borrachito y nos trataba mal a mi mamá y a todos. Compartíamos entre todos un huevito y tantito chile. Siempre teníamos hambre y nos dolían las canillas de tanto caminar para buscar trabajo. Yo me casé a los 16 y después vinimos acá a trabajar. Sí fue difícil al principio, ¿verdad? Pero ya luego me acostumbré. Lo bueno de estar en el norte es que uno no sufre tanto. Veo que mis hijos trabajan y viven bien. Mis nietos van a la escuela, tienen todo lo que quieren de comer, hasta altos juguetes tienen. Mis hijos tienen su casa y su coche. No siempre es fácil para ellos, pero hay trabajo, les alcanza el dinero y tienen una vida mucho mejor que la mía en México. What makes up an immigrant community in the United States? The answer may vary widely across geographic and cultural locations, but such a community generally constitutes a combination of SES, social capita, cultural, and access issues that play an important role in public health. Over the past 2 decades, the United States has experienced huge growth in its Hispanic immigrant population. Much of this growth has occurred in the southeastern states, with expanded need in industries such as agriculture, meatpacking, and construction before the beginning of the economic recession. Between 1990 and 2000, the United States experienced an overall 58% growth in its Hispanic population, with increases of up to 400% in some states. Georgia's overall net growth during this decade totaled 348%. The total number of Latinos nationwide, without including Puerto Rico, is estimated at around 47 million, making Hispanics the largest non-white ethnic group. Over 60% of Hispanic immigrants are of Mexican origin. In fact, no other country in the world has as many total immigrants from all countries as the United States has from Mexico alone. Undocumented immigrants also constitute a considerable proportion of Latino immigrants, with an estimated 12 million individuals making up 5.4% of the country's workforce. Unauthorized immigrants are less likely to earn more money over time, to complete higher education, and to have health insurance. The specific difficulties faced by undocumented immigrants, combined with the fact that many have U.S.-born children, as well as the effects of the economic recession on this community, have an important effect on overall quality of life enjoyed by Latinos. It may go without saying that immigrants tend to settle initially in areas occupied by others from their native region. These immigrant enclaves are highly visible in Atlanta as they are in other places. Small stores and restaurants specializing in fresh and traditional food, clothing, cultural accessories, and a myriad of necessary services provided in the native language are usually located throughout heavily populated immigrant areas. A specific niche of the healthcare market targets low-income immigrants, with clinics specializing in prenatal care, pediatric vaccines, dentistry, and emergency care. Immigrant-run transportation networks compete with governmental entities such as MARTA. Hay veces que tengo yo muchas ganas de regresarme a México, pero es por mis hijos que no me voy. Allá si uno nace pobre, sigue siendo pobre toda la vida. En cambio aquí, mis hijos estudian, hacen deportes, tampoco nos tenemos que estar preocupando por si nos van a robar o algo. Es más tranquilo, hay oportunidad. Aquí si uno tiene ganas de salir adelante, se puede. But is it really better to transition from a class-based society to one based on race?
Well, being a Hispanic woman, I think that it can affect your future. I mean, just depending on where you go to school, the area that you live in. If you, I've been to schools where, I was a minority in school, and I think if you're not strong enough, if you don't have that will to succeed, to move on, to make yourself a better person, and go further in your education, it can affect you because you feel like, you are different, that you might not fit in, or all those kind of things. And I think that can affect, certainly can affect your future.
Although everyone I spoke to suggested that success in this country depends on the individual, the hard work and optimism that can so often be found in immigrant communities do not always translate into reality. In a nation where minorities have traditionally existed as parallel societies, access to resources is not equal or guaranteed for anyone. This is true even if you have your most basic services provided to you within your cultural enclave. It is also true of education, healthcare, wages, social standing, and de facto legal privileges. Immigration policy, which has contributed to large numbers of undocumented workers and their families stuck in unregulated jobs at the very bottom of the social ladder, is a defining factor in this issue for Hispanics. Many of the issues discussed affect all minorities, and not just the Hispanic immigrant community. However, this example highlights perfectly the way in which social and health disparities affect our nation. Between July 2007 and July 2008, more than 1 of every 2 people added to the U.S. population was Hispanic. By 2050, Hispanics are projected by the Census Bureau to number over 132 million, and to comprise 30% of the nation's total population. Improved immigration policy and enforcement of all policy to protect minorities' rights and well-being are crucial for the next 40 years. If minorities continue to suffer social inequalities and disproportionate rates of ill health, the consequences will be felt even more intensely by the entire U.S.